Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
IV ketamine for depression. What patients often ask before starting. Welcome back to the Zeam Health Wellness Podcast. Today, we're talking about a treatment that a lot of people have heard about, but many still have questions about. IV ketamine therapy for depression. If you've been exploring options for treatment-resistant depression, you may have come across ketamine therapy and wondered what it actually involves. For many patients, it can feel like standing in two places at once. Part of you wants relief, and part of you wonders what you're walking into. That hesitation is completely understandable. Big treatments deserve real questions, especially if you've already tried other approaches and still feel stuck. So, in this episode, we're going to walk through some of the most common questions patients ask before starting IV ketamine therapy. What is IV ketamine, and why is it used for depression? Ketamine is actually not a new medication. It's been used for decades as an FDA-approved anesthetic, but in recent years, clinicians have begun using low-dose ketamine infusions to help patients with depression that hasn't responded well to standard treatments. What makes ketamine different is that it works on the brain's glutamate system, which affects how brain cells communicate and adapt. Because of that mechanism, ketamine can sometimes work much faster than traditional antidepressants, which often take weeks to show results. In real-world clinical studies, the results are promising, though not universal. For example, a large VA study that followed veterans receiving repeated ketamine infusions found that by 6 weeks, about 26% of patients experienced a significant clinical response, meaning their depression symptoms dropped by at least half, and about 15% reached remission, meaning their symptoms became minimal. That doesn't mean ketamine works for everyone, but it does show meaningful improvement for many patients who haven't responded to other treatments. What happens during a ketamine infusion session? One of the biggest sources of anxiety is simply not knowing what the session will feel like. A typical IV ketamine session takes place in a calm clinical environment, where medical staff monitors you throughout the process. The infusion itself usually lasts about 40 minutes. During that time, clinicians monitor things like blood pressure, heart rate, oxygen levels, and overall alertness. Vital signs are checked multiple times during the infusion and again afterward while the medication wears off. After the infusion ends, most clinics continue to monitor patients for a period before discharge. This observation period is important because ketamine can temporarily affect perception and blood pressure. What does the experience feel like? Many patients worry about what they'll feel during treatment. Ketamine can cause something called dissociation, which may feel like a sense of detachment from your body, a dream-like mental state, thoughts that feel slightly distant or floating. For most people, these sensations are temporary and manageable. Clinicians are present during the entire process, and if anything feels uncomfortable, the treatment team can slow the infusion or adjust the plan. The goal is to make the experience predictable, monitored, and safe. What about side effects and safety? Safety is usually the next major question. Short-term side effects can include dizziness, nausea, temporary increases in blood pressure, mild sedation, or dissociation. These effects are typically short-lived and resolve while the patient is still under observation. Because ketamine can temporarily raise blood pressure and heart rate, screening is essential before treatment begins. Clinics carefully review medical history, especially cardiovascular health, to make sure the treatment is appropriate. There are also questions about long-term safety. The honest answer is that research is still evolving. Many patients receive a series of treatments followed by occasional maintenance infusions if symptoms return. Ongoing monitoring helps clinicians track patterns and ensure treatment remains appropriate. How quickly does ketamine work? Another common question is the timeline. Some patients notice shifts relatively early, sometimes after the first few treatments. Others need more sessions before determining whether the treatment is helping. Research suggests that symptom improvements often stabilize around the 6-week mark, which is why many treatment protocols evaluate progress at that point. But improvement doesn't always look dramatic at first. Sometimes early changes are subtle. Patients might notice their thoughts feel less overwhelming. The day feels a little easier to get through, and mental noise quiets down slightly. Those small shifts can be meaningful signs that the treatment is helping. How do you prepare for your first appointment? Preparing for your first ketamine session can help the experience feel smoother and less stressful. Most clinics will ask you to bring a full list of medications, discuss your medical history, arrange transportation home after treatment. Because some people feel tired or groggy afterward, it's usually recommended that someone else drive you home. Wearing comfortable clothing and keeping the rest of your day relatively calm can also help. Many patients benefit from giving themselves time to rest and reflect after a session. Moving from uncertainty to informed choice. If you're considering ketamine therapy, it's completely normal to have questions. In fact, asking questions is a good sign. When you understand how treatment works, what safety monitoring entails, and what outcomes typically look like in real-world studies, the decision becomes clearer. A reputable clinic welcomes those conversations and walks you through the process step by step. At Zeam Health Wellness, patients begin with a thorough consultation, during which providers review medical history, discuss treatment goals, and explain what to expect before any decisions are made. If you're wondering whether IV ketamine therapy might be a fit for you, our team in Sacramento, Roseville, and Folsom is here to help you explore your options. Thanks for listening to the Zeam Health Wellness Podcast. If you found this episode helpful, stay tuned for our next discussion. In our next episode, we'll explore EMDR therapy for PTSD, how clinicians decide it's the right fit. We'll walk through what EMDR therapy is, how it works, and how clinicians determine when it's the right approach for treating trauma. If you're considering IV ketamine therapy or exploring treatment options for depression, the team at Zeam Health Wellness is here to help. We offer consultations at our locations in Sacramento, Roseville, and Folsom, where we carefully review your history, discuss your goals, and help you understand your options. Until next time, take care of yourself, and remember that asking questions is always the first step toward better care.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.